Have you ever scratched your eye? There are so many ways to do it. Perhaps you swiped a mascara wand across your cornea, or you were walking in the woods and a branch jabbed you in the eye, or maybe you were just taking off a contact lens and your fingernail caught your cornea, or you're
And then I
sitting
was
next to
sitting
someone
there and the
and
building went kaboom.
wham! A finger just went in and caught you right in the eye. Well, no matter how you did it, now you've got a corneal abrasion. Let's talk about how it feels, what it looks like, and what you can do about it. Hi, I'm Dr. Mike Vernon, and this channel is all about eyeballs. When you get a corneal abrasion, how does it feel? It hurts. Your cornea is innervated with a whole bunch of sensitive nerves, and when they get disrupted and insulted, they let you know about it. The first symptom is a sharp pain. You'll also experience excess tearing. You're going to see a little blurry when you look far away, possibly. You're going to be sensitive to light, and when you blink, you may feel a foreign body sensation. You'll especially know that you have a corneal abrasion because you pretty much know what you did, scratch something across your cornea and then feel pain. That's really the best clue that you have a corneal abrasion. However, sometimes you can have a corneal abrasion without feeling that sharp pain or knowing that you've got something in your eye or something scratched your eye. Sometimes people have really low corneal sensitivity. Perhaps they're old, or maybe something really small's gotten in your eye and it's just scratching your eye subtly as you blink constantly. Those are also possibilities. Whether you have a lot of pain, a little pain, your eye's hurting you, you're feeling something in there, you're suspicious that something's wrong, you gotta go see a doctor. Come on in, I'll take a look. My receptionist has come back to tell me that I've got a patient that thinks they have a corneal abrasion sitting in the waiting room. Let me describe for you what the classic corneal abrasion patient behaves like when they're in the waiting room. Oh, they're just covering their eye, it hurts, they're tearing. They've asked the receptionist, please turn off the light. I just am so uncomfortable. That's how they look. I need to have them come back. I'm going to take a look at their cornea. Before I do that, let's review what the cornea is. The cornea is that part of the eye, the clear part of the eye, right in the front. And it kind of has a little protrusion forward. It's comprised of 5 layers. And the outermost layer is called the epithelium. It's only 5 to 7 cells thick. The corneal epithelium that's only 5 to 7 cells thick sits on top of another layer of the cornea that is super tough. And it's really hard to penetrate it or any of the other layers of the cornea. So when someone comes in with a corneal abrasion, I'm really focused on the epithelium. Now I bring back my clearly uncomfortable patient back to the exam room. The first thing that I'm going to do is have him sit down in the chair, and I'm going to look at his eye with my microscope, with the slit lamp. I want to get a broad view of how the eye looks. I'm also inspecting for other things that could be causing the eye discomfort. Patients come in and think they have one thing, but it turns out to be another. So to be sure, I'm going to look at the front of the eye right inside behind the cornea to check for inflammation or maybe some blood inside the eye. I'm going to look for evidences of bacterial infection. After my views of the cornea with the white light, then I'm going to put in a little bit of stain. It's an orange stain that I put into the eye, and I use a blue light, and that blue light makes everything turn green on the front of the eye. Now, I mentioned earlier that it is rare that something would actually penetrate the tough layers of the cornea, but I do check to make sure. If it is a penetrating wound, I'll see this little cascade of fluid leaking down the cornea through the green lit tears. All right, no inflammation, no bacterial infection, no penetrating wound that's causing the eye to leak. It's simply a corneal abrasion, and I can see it. It is so easy to see with that green tear film completely illuminated and made light. That corneal abrasion is going to just shine super dark green relative to the light green all around it. There are generally 3 categories of corneal abrasions. There's the small kind, there are the big huge kind, And then there are the subtle, scratchy kind, made by just kind of a small foreign body that's usually caught up behind an eyelid. First, let's talk about fine scratches on the cornea, something that looks like this, up and down lines. When I see that, I know that there is a foreign body trapped underneath the eyelid, and I've got to flip the lid, look for it, and then with a tool, I'll take it out. I'll put the lid back and then I'll let the patient know, hey, you got scratches on your eye, on your cornea, but don't worry, it's going to heal quick. The good thing about corneal epithelial tissue is that it is the fastest healing tissue in the whole body. By the next day, all those scratches, I can expect them to be gone. Next is small corneal abrasions, something like this. Remember, the whole cornea has that dye on it. It'll appear light green, except right where the abrasion is, the dye will pool there and it'll appear bright green. It's super easy to see, and I'll let the patient know, hey, you've got a corneal abrasion. It's not very big, but I'm going to give you an antibiotic just to make sure that it doesn't get infected. Unlike those fine scratches on the cornea from a foreign body under the lid, this can get infected, and I want to make sure that it doesn't. In 1 or 2 days, I'll have the patient come back to make sure that that corneal epithelium fills in and smooths out. And once I see that, I'll let the patient know all is good and they are on their way. Finally, let's talk about a big corneal abrasion, something like this. Now, yes, it's obviously way bigger and super easy to see under the microscope, but in the end, it's quite like a small abrasion. It's going to heal pretty quick. It may take an extra day or so, but in 1 or 2 days, it's going to get better. But it needs a little extra help. So I'll put a contact lens, it's called a bandage contact lens, onto the cornea to help guard it against the eyelid blinking over it all day long. This encourages healing, and it also helps with comfort for the patient while it heals. I'll still prescribe an antibiotic. I'll have the patient come back the next day to make sure that the corneal epithelium is healing or healed. It probably won't be completely healed. I'll have them come back the next day. By then it's usually completely healed. If not, I'll have them come back 1 more day, and by then it should be all better. One more thing. Do you remember at the start of the video I pretended to get hit in the eye with a branch? If you get a corneal abrasion caused by a branch or vegetative matter, be sure to mention that to your doctor because vegetative matter can infect your cornea with fungus. Anyway, when you're out there in the world and you're walking through the woods, be careful of low-hanging branches. If you're trying to take your contact lens off, be careful of your fingernail. Don't let it scratch your cornea. If you're sitting next to someone telling wild stories, duck so they don't hit you in the eye. And finally, when you're putting on mascara, be careful with that wand. Do not scratch your cornea. Nice talking to you. I love you. I'll see you next time.